We aren't out of the woods yet, so my friends. This virus, it's a terrible threat. It continues to spread, and as we see around the world, countries are getting hammered by COVID-19. In Ontario, we've done better than most, but we can't take that for granted. A second wave of COVID-19, it's coming. And the officials are telling us that the second wave could be more complicated than the first one. So we can't sit back, we can't wait. And that's why we've been working around the clock to get ready for the second wave. We've invested billions of dollars. We're expanding testing, getting the systems in place, stockpiling PPE. And my friends, we saw the outset of this virus that having enough ventilators, having enough of these life-saving devices, is critical.
Well, first I would say that the good news here is that people are going to be tested. We've asked people to do that if they have concerns, if they have some symptoms, if they feel that they've been in touch with somebody with COVID-19, we want them to be tested. But they also deserve to be tested in a timely manner. And we are aware that there are some significant lineups in many different parts of Ontario. So we are looking at the best way to address those issues, whether it be through pharmacies, through labs, through other ways to enhance our assessment facilities. So as the Premier has said, we are looking at all of those alternatives right now, and we will have an answer in the next few days, because you're right, people are concerned, particularly for their children going back to school. We did anticipate an increase in the lineups, but perhaps not to this extent, and so we will be ready. We are boosting our capacity at assessment centres as well as our lab testing facilities, because it's one thing to have the test, but you also need to have the test read and understand whether you have COVID or not. So we are increasing our facilities in both of those areas.
We are hammering the testing. You look, we're 38% of the population. We're doing 52% of the testing, and we're going to continue ramping up. You know, you always see the numbers. I think yesterday was 29,000, but we're always hovering in between 23 and 30,000. We're going to be ramping up to a lot higher numbers than that. We're getting ready, and again, I just want to thank the Matt Andersons of the world, Dr. Dirk of the world, and Dr. Williams, and all the health teams, all 34 of them around the province. Folks, we're ready, we're ramping up, and I know there's going to be a few bumps, but we've been able to get through it. And some of the accomplishments that the private sector and the people are doing are phenomenal. And I just ask, the small percentage, the 1 or 2% are having these parties in the backyard. Guys, we just can't do it. I'm like, we just can't do it. It's not from a lack of advertising. Unless you're living in a cave or you're living underneath some rock somewhere, like, you can't turn on the radio, you can't turn on the television without some advertising from the federal government, provincial or municipal government. And it's not the whole province. It's 3 areas that we see the outbreaks. We have a phenomenal tracking and tracing team, and we're going to be all over this. So just stay tuned. Over the next day or two, we're going to be rolling out announcements for regions that are affected, and also about the testing and taking the burden off the hospitals and other testing areas.